visit me on Facebook.
Hi, this is Annie Naylor, and I am with Arizona Muscle Therapy Center here in Scottsdale. And I am back here today to talk a little bit more. We had talked previously on a YouTube with my client and friend Casey, who I worked with through her 2 pregnancies. And we wanted to just really delve into the subject of one of the reasons that I really feel that Casey did so well having these babies was that she's very physically fit. It's important that women understand through their pregnancy that they do need to stay physically fit, and they do need to do a good exercise program and a good stretching program. Mm-hmm. So I want you to talk a little bit about what you were doing, because I would see you at the gym and right through your pregnancy, and she was weightlifting and she was doing a lot of stretching. And so if you could talk a little bit about that, that'd be great.
Sure. Thanks to some good accountability and motivation, I was strength training and doing some high intensity interval training throughout my pregnancy, really up until with my firstborn. I was working out up until about a week before I delivered her. Mm-hmm. And then with my son, it was just a few days because he came early, so he was a bit of a surprise. Strength training is really important through pregnancy because it helps me to preserve my muscle mass, and then post-pregnancy, it's going to help me stay in good shape and get rid of all the extra unwanted body fat after the fact. So it actually helps, and your body adapts to the weight that you're putting on for the pregnancy. Mm-hmm. It continues to build muscle and in a sense makes your body more efficient at keeping that fat off. So it was helpful.
And it's really important too, because as Casey talks about, you are going to put on those little extra pounds when and after you deliver your child. You want to try to get that weight off as quickly as possible. If you have your body used to a fitness program, particularly in weightlifting, and the things that you were doing were very, very important, her weight's going to come off a lot quicker. She's going to get back into her fitness regimen, and her body's not going to forget that. Mm-hmm. That muscle memory is very, very important, and the body's saying, good, she's right back into it again, and she's doing it. Mm-hmm. And so I'm going to be very cooperative about letting all of that drop off. Mm-hmm. I said to your husband one time, being the trainer that he is and at the level that he was, I said, if a woman comes into the gym and walks up to you and says, I want to lose weight off of my waist, mm-hmm. what are you going to do? He said, I'm going to take her into the gym, and he said, and I'm going to work the heck out of her legs. And he's right, because you go after those big muscle compartments, mm-hmm. and they want to feed. And so getting out there and hiking and getting into the gym, and I don't want women that are pregnant to be fearful about weightlifting. Mm-hmm. Don't you agree?
I absolutely agree, 100%.
Yeah, I think that it's very, very important, and there are very good people out there that can show you how to do really good weight training while you're going through the process of having a child. Mm-hmm. So, yeah.
Yeah, it's definitely safe and effective.
Great. So I want to thank you all for joining me for this little YouTube on pregnancy and fitness today. And again, this is Annie Naylor, and you can contact me at www.arizonamuscletherapy.com. You want me to say that again?
Yeah, you can. Yeah, go ahead, and then we can cut it in there.
Okay. So thanks so much for joining me for my pregnancy fitness YouTube today. This is Annie Naylor. You can visit me at www.arizonamuscletherapy.com or visit me on Facebook. Have a great day.